going to be and excellent Dr. Jhpiego. She speaks a little bit of Kiswahili, to give us some opening remark, and thereafter the rest will follow. Very well.
Great, thank you, Dr. Mary Rose. She always said that her boss are really a very hands-on session, so that you will learn not only about kind of advocacy, but also kind of when you are going through, or when your loved one is going through an early diagnosis screening, you will understand all of the steps that takes. So we're very excited. The timing is great because it is Breast Cancer Awareness Month. There are free breast cancer screenings around our salon. Please ensure that you are taking your loved one. Men and women who will learn about should go for breast cancer screening. This project, funded through Pfizer Foundation, is incredibly close to my heart. My stepmother is a breast cancer survivor, and I lost one of my best friends at age 43 for breast cancer 3 years ago. So it's the second leading cancer in Tanzania, and Mary Rose is a huge advocate for prevention of women's cancers, from her HPV to CCAP work through breast cancer. So we're very, very pleased to be bringing this to Tanzania. Tanzania and the continent of Africa is on the forefront here. We have Pfizer has projects in Tanzania and also in Ghana. But really what is being used here can really advance awareness and early detection of breast cancer across the continent, where we're seeing it really increase as we see kind of environmental factors as well as other factors increasing the rates of cancer in our populations. So I would like to just acknowledge Dr. Mary Rose and all of the Pfizer team that work incredibly hard. We have some amazing practitioners, I lost them. Today, I'm not going to name them all, but we have some really, really amazing practitioners who are really the heartbeat of this program. We have radiologists, we have oncologists, pathologists that are here today to work with you to learn. And then, of course, my dear friend, Dr. Mzee, who is always such a good advocate. So we thank you, Dr. Mzee, for your leadership and advocacy in this area. So without further ado, I hope you guys roll up your sleeves, learn a little bit, and then practice some hands-on skill on early detection of breast cancer. Thank you so much, Dr. Mary Rose. And I'll invite Dr. Mzee to come over and take the mic for me. Oh, not Dr. Mzee? Oh, and of course, yes. We also have a wonderful Zanzibar representative here. We are very proud that this project is not only on mainland, but we always, Mary Rose and I never forget Zanzibar. So Dr. Mary Rose is also helping us out with some key senior staff that are amazingly supportive in Zanzibar. So thank you so much. All right, Dr. Mzee.
Habari za mchana. Nawasalimu kwa jina la Jamhuri ya Muungano wa Tanzania. Thank you very much, Alice, for giving us this opportunity to officiate this session. Coincidentally, this session has been scheduled this month. As you have said before, this month is the Breast Cancer Awareness Month. I don't know how many of you are aware of the breasts. You have them, but maybe you are taking them for granted. And this is this is not only for women and girls, but it's also for men. As the global data says that about 2.3 billion people are diagnosed with breast cancer every year. 99% of those people are women, but there's a 0.5 or 1% of them are men. So everybody who has a breast should palpate their breast, should make it a habit of checking their breasts. We thank Jhpiego for bringing this initiative. Currently, as Alice has said, it is implemented in 9 regions, and 4 of them are in the mainland Tanzania, in Tanga, Mwanza, Morogoro, and Mtwara. In all councils in these 4 regions, and the regions in Zanzibar. We hope that after this project ends, we are going to roll it out to the whole country, because it has been very useful to identify even early changes, especially in the rural areas where 80% of our people are seeking medical care. This program is also very useful because it is building capacity, it has engaged all levels of health care system in Tanzania, with facilitators from the national and zonal level, backstopping the healthcare workers at the secondary and tertiary, the secondary primary level facilities, and along the way providing care for the people in these areas. So today, as been said, this is not a session where people are going to present agendas and things like that. This will be a hands-on, it's like a mini workshop. So we shall be going around and see what is being done. We do 3 things in one session. Medical breast examination, breast ultrasound, and fine needle or cold needle aspiration biopsy. We bring all the services which are needed at one place. This is very useful for our people who are in the rural areas, who otherwise they would have gone to the hospital for examination and biopsy, and they would be told to go to another place for another diagnostic intervention. So all these diagnostic services at one point has been very useful. It's time saving, it's cost effective, and it has increased or improved the quality of care for the breast carcinoma in these regions, and we hope that we are going to roll out the program. Asante sana, wakaribisha na baki. Let me acknowledge the presence of Director Health Promotion. Actually, this is his man. Breast cancer awareness man. He's the one who is bringing awareness to people. That's how it goes. Dr. Rashid is also here. We are going to take this opportunity to roll down him for with something. Because what we are doing actually is of advantage mainly to the community. And if there is no Dr. Rashid, it will be difficult.
Thank you so much, Dr. Very big round of applause to my boss. Alice was not applauded before. Also to the Zanzibar Ministry, who refused to speak because he's not feeling well. And also Dr. Mzee, officiating on behalf of the ministry. So we are also blessed to have directors, Asante Sana Dr. for coming to our session. And the next remarks we're going to hear from the President of Office of Administration and Local Government. And we are so blessed to have Dr. Rashid around us. He normally doesn't miss all our sessions when we conduct them with Tanzania Summit. He has actually facilitated how many sessions? 3 or 4. This is going to be the 4th one from yesterday to today. So Dr. Rashid, you know you're tired. Just a few words so that you can have your blessings before we start carrying on.
Thank you very much, and thank you for this respect. Good afternoon again. So my name is Rashid Faume. I'm a Director of Social Welfare and Mission Services. I'm the President's Office, Regional Administration, and local government authorities in Tanzania Mainland. Maybe there's a 7 minutes with Tanzania Mainland. So on behalf of the Deputy Permanent Secretary, POLAJ, Professor Tumaini Namu, just I'm going to read to you, or I'm going to present just a brief message. Rashid plans to deliver on this important forum. I greet you in the name of the United Republic of Tanzania. First, let me start by thanking God for giving us good health and enabling us to participate in this important symposium conducted through big breast cancer projects. That is breast cancer and care from assessment to treatment. Implemented by the Ministry of Health and Welfare with examination and technical support from Pfizer Foundation, Jhpiego. In particular, I would like to express on behalf of Vice President Samia Suluhu Hassan, the President of the United Republic of Tanzania, our sincere appreciation for understanding and supporting the health sector. Organizers, thank you very much for inviting me to provide the official remarks in this important event. I would also like to thank you all for joining us to combat breast cancer in Tanzania. Specifically, I take this opportunity to thank Pfizer Foundation and Jhpiego for supporting government efforts to address breast cancer in Tanzania through early detection intervention, targeting women and men living in unreached areas, and the PRI being one of the major beneficiaries. We all know that cancer is a disease that affects people of all ages. We have observed cancer causes significant losses to the nation because the disease reduces the workforce and slows down the development of the individual and results in the family dependence and increasing the burden on the health system. In Tanzania, breast cancer is the second most common cancer, representing 14.4% of the new cancers and second most leading cause of cancer mortality among women. Cervical cancer is the leading cause of cancer-related death in women with around 10,000 new cases and 7,000 deaths each year. The number of new breast cancer cases is projected to increase by 82. I think we will also get these presentations maybe more updated ones by 2030. Together, breast cancer and cervical cancer accounts for more than half, that's 50% of all cancer cases in women in Tanzania. If detected early, the survival rates for most types of breast cancer would exceed 90%. In Tanzania, women with breast cancer tend to be diagnosed at advanced stages, leading higher mortality rates than in more developed countries. Approximately 80% of the women are diagnosed with advanced stages, most of them being 73 and 74, due to limited availability of early detection services, limited diagnostic services, or limited access to the treatment services. I would also like again to thank Pfizer Foundation and Jhpiego for giving us handful of support on this initiative and contribute to enhance access to breast cancer and detection services in 9 regions in Tanzania. That is 4 in Tanzania Mainland and 5 in Zanzibar. I request other partners also to collaborate with the government of Tanzania on the similar pillar. We understand that there are various challenges which contribute to the women not being diagnosed earlier, including low understanding, misconceptions, high medical costs, and stigma. Due to the burden of breast cancer, combined with high cost of treatments and the limited resources available in Tanzania, health authorities and policymakers have made breast cancer a priority. To date, the government of Tanzania, in collaboration with the partners, has responded in several ways to address breast cancer as a public health issue and has spearheaded the implementation of reproductive health cancer activities for cervical and breast cancer to improve access to breast cancer awareness screening, diagnostic and treatment services across the country to contribute to breast cancer control. The key objective to build breast cancer program is to expand access to integrated breast cancer awareness, detection, treatment, and palliative care in order to reverse the growing number of people suffering from this disease and to reduce the current mortality rates in alignment with the WHO Global Breast Cancer Initiative to achieve 60%, 60 days, 80 targets. Target 1, 60, diagnosed in 1 and 2, target 2, I know you all know this, I'm just reminding you that the two-time breast cancer diagnosis within 60 days, and three comprehensive breast cancer measurements, more than 80% should be treated. I would like to recognize BEAT breast cancer project is implemented for 3 years from 2025 to 2027. And our partner Jhpiego working in close collaboration with the Ministry of Health and our regional teams in Mwanza, Tanga, Morogoro, and in Mtwara, as well as cancer institutions such as the Ghana College Center, Ocean Road Cancer Institute, Good Samaritan Cancer Hospital, Ndanda Hospital, and the Lumumba Hospital. Congratulations to Pfizer Foundation, Jhpiego, and regional teams that implemented and brought to these outstanding results. The government appreciates this project's fighters on early reduction and detection of breast cancer. Ahead, we were able to present our work during the 75th WHO Regional Member States Committee in Zambia this August 2025. Congratulations to everyone who was able to present us. Assembly acknowledged this symposium with a learning on proper management. In conclusion, in conclusions of Tanzania, patient workers working in rural areas in our joint effort to educate and provide screening services about breast cancer.
We wanted also to acknowledge reproductive cancer counts 1, 2, 3, 1, 2, 3. I'm starting from there. And then remember your number so that you don't go into another group. Okay, so 1. All the ones coming here, all the ones coming here, this side. Let's proceed at the back. Where are we? Yeah? 1, 3, 1, 2, and then 3. All the ones going front, and then let's proceed. 1. 3, 3. All the ones in front, all the ones in front. 1. 1, and then quickly. 1. One's going front 1, 2, 3. 1, 2, 3. 1, 2. Which number are you in? 3. 2. Okay, all the ones down in front, come this side. Come this side. All the ones, all the ones, all the ones, all the ones. And then all number 2 go there in the corner. Number 2. Number 2 there in the corner. We're going to arrange the chairs not worry. Number 2 in the corner. And then number 3, I'm going to give you another instruction. Number 3, come on the right side. And then facilitators come in front because I have to introduce you. Number 3 on the right side. 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 So 1, 2, 3. Okay, let's start. You manage my exercise. Right? And then so all the ones here, all the 2s there, all the 3s here. 3 on the right side, 3 on the right side. Moja huku, mbili kumenisha. Are we together? come forward so that we can introduce you. Jamani, facilitators na ugeni basi mbona kama so big round of applause to our facilitators. Big congratulations to you for being capacitated by specialists today. Make use of their time to learn and come up with something, okay? So I'll give them the microphone so that they can introduce themselves and the role they will play today and the role they play in the program.
Thank you. Good afternoon. My name is Dr. Presidenti at Catholic University of Health and Science, Uganda. I have 6 years of experience working in the Department of Radiology and Intervention. I'm interested in doing breast cancer operation and research. So today, I have an idea to share with you some few things regarding the role of breast cancer in achieving pillars number 2 on promoting breast cancer awareness and prevention. Thank you very much.
Good afternoon, everyone. My name is Alex Roshaka. I come from the University of Health and Life Science in Mass. Today I serve as a pathologist and lecturer. My role in our project, the breast cancer project, one, I serve as a trainer. I train medical doctors on how better to collect and handle specimen for better and accurate breast cancer diagnosis. An activity that is routinely performed by pathologists, but for the sake of the project and for capacitating our medical doctors, we move around in all the regions where the project is running to capacity the medical doctors to perform better procedures. But also I facilitate on the aspect of finding aspiration for cytology for the same reason as one of the core requirements of WHO when it comes to the pathologist. People aspect.
I'm a general surgeon, a senior surgeon with experience of 8 years. So in this program, I serve as a regional facilitators in the training of breast cancer awareness for patient breast cancer. But also I serve as a trainers for other regions, coordinators, specifically coordinators taking for confirmation of breast cancers. So today's employee programs I will show you and facilitate you on how this is performed coordinators for confirmation of breast cancers and thank you. You're welcome.
Good afternoon. My name is Dr. Machach. I'm a oncologist in this breast cancer project together with the Ministry of Health and Pure Life. My role is facilitator of show pillar 1, which is prevention of breast cancer, and pillar 3, ensure comprehensive management of breast cancer.
Thank you very much. So we are going to have 3 sessions. Session 1 here. Session 1 here. You will put your chair and come and sit closer to these 2 screens. Okay? And then number 1 is all the ones raise your hands. And then you will learn here 2 skills. You will define illustration cytology as well as breast cancer management briefly, because time is not on our side. Briefly here in both strengths. You can ask as many questions as possible. And then group number 2s, are you there? Say yeah. Yeah. Very good. So you'll be here. You learn about 5 illustration cytology. We are going to put all the chairs in between so that you get the space of learning and asking questions. Okay? And then group number 3 is 5 illustration cytology. Corridor biopsy. Group number 3 say yeah. Are you there? You have money in your bags. I can take care of your bags. So you're going to be with Dr. Rashid, and then you're going to learn on corneal biopsy, okay? So corneal biopsy, 5 illustration cytology, and in the screen, you will learn breast imaging and breast cancer management, okay? And then I'm handing over to Alice to explain on the time management.
Great, so I am people and time management. So you will have 15 minutes of each session. When you hear this, you need to start moving. We will be moving counterclockwise. So move 1 will go to 3, 3 will go to 2, 2 to go to 1. Okay? So you move around counterclockwise. Okay? So I will go ahead and have, it is 1:12. We will rotate at 1:27 and I will give you this cue. When you need to move, I will give a 1-minute warning to facilitators that they need to wrap up in 1 minute before they lose their group. All right, go ahead and begin. Learn away. Thanks.
We have a symptomatic disease. So we may know some general once you have any lesion, more likely to get accepted. This lesion is a cystic
Next slide.
Next slide. As I said before, we have a standard which we call a virus. A virus is the imaging we go to the data system. This is the best use. Even if you go to the rest of the Zanzibar, we all use the same, let's say, this is the which was developed by the GLOBOCAN society. But the guide, even if you know that this, if you are given these findings, but to be able to say this lesion is green, this lesion is wrong, this lesion was intervention, this one I should do intervention. So this is our, as you can see, these two categories. We have category 0 and category up to category 7. So, in other words, you can even if you see any lesion, this lesion falls under which category? First, category 0 means you have scanned this woman and you have not seen anything, but she is still complaining of symptoms. Right? You can have the first extent, but you have some ultrasound and there is not any findings. So the next step, we call it this person will come out of category 6. We need an additional image. Whether you subject to one MRI or but for category 6, category 0 is category 6. Category 6 is already known. The comes by what we see. I have already been diagnosed with have breast cancer on the night. But right now, I have symptoms even. So we want to see the existing condition. That's why the diagnosis is normally we already have cancer. So we have category 1, which is typical benign, category 2, which is typical benign, but category 2, which is suspicious, category 3, which is suspicious.
Gracias. have 5 minutes to check the
check up.
You need to categorize according to the providers, which is category. Whether that region is category 0, category 1, category 2, category 3, 4, 5, 4, 6. So let's say one category like the pathology and breast demand. That one has some of the classical features or anatomical features, like areas of classification. So in our group, that's goes under category 4 or 5. But in that region, it has a well-defined category 4 under category 2 or 3. The difference between 2 and 3 is 2, it is typical, the 9 is right. If you find a girl,
1 minute left. 1 minute left.
But if you find a woman which is having almost 35 to 40 years, far more breast, but those features which we see in an ultrasound, there is high chance of that. You see, we think about the before, because even suspicious, it is far as a imagine so all of these, also, once you see an lesion, the way you touch it, how it immediately.
Okay, we should be wrapping up. Wrapping up. Okay, you have 15 minutes. 15 minutes. Your next station. 15 minutes.
established tool which we use to categorize different stages of the breast region. And that's what we are able to make the judgment whether this person needs to do a biopsy, needs to do a follow-up, needs to do an aspiration, or needs just like an additional imaging evaluation. And that's why we call it sometimes not enough. That's why there is also a role of mammogram, the conventional MRI. Yeah. So, in the case of, for example, severe litigation, what do we need to do? Anyone has a symptomatic breast lump, and then screening before. A lump depending on the solidity or number. Anyone who is lost in a breast lesion during pregnancy because the woman who is also you can subject her to realizing that because ultrasound is an analyzing so the different representation including breast surgery and the breast lump, the male, that's why we say even a man can develop a breast cancer. That's why it's also a lot of so this is what we call a biopsy assessing technique. It's a straightforward laboratory imaging and reporting data. So this is our tool which we use to characterize different breast lesions so that it guides you whether these lesions fall under which technique. So bias president or category number 0 all the way to category number 6. So category number 6, this is already known patient with the breast cancer. Remember, we have like breast cancer on the left breast. And sometimes they usually depend on the left side. So we need to know this is an existing condition or is it a new disease. And that's why here, if you have that woman, you will follow another category, number 6. But category number 1 is like you, if you're justified to do some breast, you know, a breast examination, and we do a breast examination, that means category number 1. So if you tell somebody, I have a bias in category number 1, so what can that mean? This patient is having what? A negative? Even though the benefit will not has to do what we call a routine screening based on the risk factor. Automatically, the elevation of the screening becomes so if you have any lesion, so now if you start the patient and find this patient that lesion might have different features in relation to what you are going to do. Because if you find any lesion which looks like a well defined one, with another lesion next so here we have, as you can see, this lesion down there this lesion here has divided but this one has a defined one. So you can even see which one looks bad. This one. So actually, if you go back and provide that how you can utilize this based on the imaging features. So the one with the poor defined one have a higher chance of being malignant, not because we did it historically. That's why the ultrasound, all the other substances use technology features highly suggested multiple numbers because we did it historically from the so you can see this one, if you compare this one to this one, you can even see but as compared to this one. So one special, this one is going to follow under category which is highly suspicious, highly
not success before. Everybody knows he's a female body.
therefore, any changes, features of breast cancer not necessarily for you to evaluate but even as normal scans, that is already more than approved. And on all circumstances, like this, you don't expect to see something coming out from the liver. Not for the pregnant women, but when any might also see a massive So, the categorize them as a category 1. So if you tell someone this lady that is category 1, so automatically I know that category 1 means what? No. But category 2, it means the lesion which you see, it is all into category 1. But if that lesion you think it is 50-50, whether benign or malignant, it is probably benign. So the management plan will change according to the behavior of the lesion. So normally, what you see is next. Yes, okay. So any lesion here, they usually appear like this. So if you see something like this one looks very questionable. The same applies to this one. We can all accept them of president. But the behavior of the inside structure looks different. So any lesion which contains fluid appears dark. Because in the ultrasound, the fluid usually appears dark. So brighten, it is typical cystic lesion. So it will fall under which virus category? If somebody gets between 1, 2, 3. 2, because 1 it is no element. Category 2 is typical benign. So if you go to this one, it has some solid component and it is typical benign. So the idea is the margin with this one irregular margin. This one will go beyond the category 3. That's why there is a role of imaging. Go back. Back again, yes.
1 minute. 1 minute.
What again? Yes. So when somebody tells me it is a solid it is pure system because this area here looks purely dark. Next. How we distinguish the previous one from yes. So the last one is this one. Yes. So the last one is this one. That's there. It's most important for an historical. Okay. So for most what we call normal dilated duct. But that's what we call dilated duct. If it is we normally measure the size. It is pathological. You need it and intervention. Because you might compare to yourself, feel like there is overs. But if you see something is coming, not even if they don't need it further, it also be one.
Okay, we're going to wrap up. We would like everyone to come and now sit in the main plenary, and we will wrap up the session. If everyone can sit in the main plenary, that would be great. Thank you. Everyone is sitting in the main seat. You need to be able to see the screens for the final presentation.
Let me teach you on how to manage breast So have two options. We have local therapy and we have special therapy. In local therapy, we have surgery and we have radiotherapy. When we say local therapy, we only look at the breast site. So local therapy is breast, like surgery or radiation therapy. So surgery, we have converted prostatectomy or total or single prostatectomy, or we have a breast conservative surgery. So we are moving from removing the breast to conserving the breast. In radiation therapy, we use high energy from X-ray, photon, or proton to treat the cancer cells. So we can be given after surgery to treat or slow cancer growth. The treatment is given in small doses per day. On weekdays, we give from one on Monday, Friday, then the patient rests on weekend, then start again to allow the normal tissue to repair. Because when you give radiation therapy, both the cancer and the normal tissue die. So we rest on weekend to allow the normal tissue to repair because they can get to repair since they are not cancerous. But the cancer cells, they will die. Their DNA will open and will not able to proceed to the cell cycle. So it is given in 2 grams per day, from Monday to Friday, and weekend off. And the dose range from 50 grams in 16 to 25 days. So the patient will be treated with radiotherapy in 4 weeks or 5 weeks. So in terms of systemic therapy, this systemic therapy, we say breast is a systemic disease. Benefits in the breast alone, but it can be somewhere in the body. So for any tumor who are not sensitive, how to treat chemotherapy. So chemotherapy is a standard of care for the treatment. So it kills the rapid dividing cells, including the hair and the leg. So when we give them chemotherapy, that's why the hair they go off. But as a treatment, the hair will come off because chemotherapy they are killing all the rapid dividing cells, including the hair and legs. So when they are in the patient you can see the hairs are off, even the legs are turning. So it is a minimum IV or IM for cycles, either weekly or bi-weekly, but majority of them we give them 3 weeks in 6 to 8 cycles. So it is around 7 to 8 months of treatment. So we recommend the patient ER or ER. I know Dr. Alice talked about this one. This one we get the tissue biopsy and we test for the receptor that causes the breast cancer. So if you test for estrogen receptor or progesterone receptor, and we test for HER2 receptors. So chemotherapy for those who does not test for any of those, they will test for chemotherapy. But for those who tested for ER, they can get chemotherapy and for those who tested as HER2 positive, they can also get chemotherapy and then targeted therapy for that receptor. So for example of chemotherapy, cytology, cytology, and biopsy. So we have to prepare your patient to receive this medication in terms of monitoring also the cycle. For example, cytology is a cytotoxic, so we have to check So we have another category of targeted therapy, indicated for those who tested positive for human and human factor 2 receptors. And when you test for this is the mark of prognosis. But the good thing is you have a drug that can target this receptor to stop the cancer growth. So, for example, we have trastuzumab or trastuzumab, where they have a combination of the two agents given for a period of 1 year. After the completion of 1 year, we know that this receptor will be suppressed and you will no longer, you will be free of cancer. And we have endocrine therapy. This is the standard of treatment for breast cancer. For those who tested with the estrogen receptor or progesterone receptor activity, and we have tamoxifen for premenopausal women and the natural menopausal women. And this drug are given for 5 to 10 years to prevent 15 to 10 years recurrence of breast cancer. You understand? Yes. Next. Any question? Any question? So we have local treatment and systemic treatment. Local treatment, we have surgery and radiotherapy. And in systemic treatment, we have chemotherapy, we have targeted therapy, and then radiotherapy. Question?
There's another question here where all those who have questions, raise your hands. Ziko nne. Moja.
Thank you. Good afternoon, everyone. I'm Atuwaza from Money Girls Organization. So my question is, maybe the facilitator said it, but I didn't catch it. Both by biopsy and final aspiration pathological tests. So what determines from the ultrasound whether you go for the biopsy or final aspiration? Another thing, can we get these materials?
Yeah, thank you very much. I'm Sharon from London. So my question goes to the like for two questions. First question I was asking is, does the program cover for those desperate people, like those who can't afford the treatment, those who, because most of them they suffer from how are able to pay for both the investigations but also treatment. So does the program cover for them? And how is the logistics? And the second question, there is this consumption that there is so much myth that goes on with breast cancer, especially with biopsy. So many people believe that once you do biopsy, then it is spread the disease. So like, how does the program work in demystifying the myth, the general population, especially in the rural setting, just in where you see that concept?
For the materials, if you can reach out to Radia, who's right here. Radia, can you wave? Or David. Okay, and then you can get their email and you can make sure the presentation is shared with you. Okay, thanks.
Okay, let me start responding to this question. She asked about the side effects of chemotherapy. So chemotherapy has side effects. For example, I located the solutions and phosphomite, and every drug has its side effects. So before management, for example, solution in the cardiologist, you have to check your heart rate. You have to make the injection fraction more than 55% for you to give solution. Again, paclitaxel has the same effect of peripheral neuropathy. This patient is suffered with a numbness. If you have a previous, you have a neuropathy before chemotherapy, we are not going to give you paclitaxel because it's university. So we'll give another group of medications that belong to the paclitaxel. It's called paclitaxel. And the cost of chemotherapy, remember, we are working with the government. The government supports cancer benefits. So there are some of the drugs that are given for free from the government. And those, for example, radiation therapy is given free in the Ocean Road and the Uganda. But for those private sectors, they have their incentives. But for the government hospital, radiation therapy is free. So the government is paying for it, and some of the drugs are paid for by the government. But the estimated cost is around like maybe 1%. So remember the business is excellent. So I urge you to change your mind to contributing to policy and contributing to cancer management, like what Kenya are doing. So when you look at the patient of cancer, ask you to contribute, please be there for them. If you are contributing for the health, why not for cancer treatment? They are very costly. And another thing about you ask those questions about remember, these projects are working with the government, so the government is important. They are able to pay for their investigation, also pay for their surgeries, but in terms of management, the government is very important. Thank you. Have I forgot to answer another question?
Regarding the myth on biopsy, case of patient that after biopsy, the patient may die. Yeah, I think a myth will be a myth. I don't think it will be one day can be something. Yeah, we are all doctors. How many of our clients died just because of the biopsy? To explain, yet the whole thing with the court difficult. So maybe one of the things that can explain there is through that when we talk about clients that we are seeing,
Thank you, thank you very much. Asante sana. It was a very lively Isha. If you can assure me that we use this class.
Well, yes, I have one request. Today we have an opportunity to see some projects that Jhpiego is doing. They are the only organization that are supporting the advocacy of cancer, surgical cancer management that I know currently in our country. We are lacking the opportunity to discuss profoundly cancer management in Tanzania because we don't have the platform for discussion. We come to this platform, it's very strict, it's very tight. It's high time I request Rose and your team and others, medical associations, we can have a breast cancer conference like our other colleagues are having in Egypt, in Germany, in Oman, those places, so that we discuss this disease comprehensively and we champion the advocacy. Thank you very much.
It is actually, you have said that a lot of time. Before we close this session, I just want to ask 3 people to give us their feedback as to how they feel after this session, the takeaways. Any volunteers or whatever, it's here, like I do system, so.
Keeping on learning more when it comes to forum talking about breast cancer. As we understand, this is taken because of brutality among women, but also men. So for this forum, especially the way you set it, it's 3 sessions, it is triple learning. So I've learned a lot, not only the content, but also how to set it so
Asante sana. Any other response? Karibu. Thank you for your advice. Any other response? As a takeaway lesson? No, but I feel I'm
especially for Tanzania Mainland. I don't know about that, but for Tanzania Mainland. And my colleague here is taking care of our medical students in Congo. Then I was like, since in Tanga we've had more patients on the road, so they put more data. Now I'm like, okay, you lobby the government. Let more regions send patients to the road correctly so that we can get correct data. I'm sure there are some regions where they get a lot of cancer, especially this cancer, especially from where I come from, but the referrals are fewer. So maybe when you use the data from what you wrote, who has been, which region has referred more, we might lose some of the regions which have got really worse number of cancer patients. That was just my curiosity. Thank you very much, advice.
Asante sana. We know the report has been taken, we will work on it. I think these 2 responses are enough for the feedback. Now, before we close this session, let us have a short video on the programs. this program in the country. And I have only two things to remind you. This is breast cancer month. This is a month for breast cancer awareness. So take care of your breast. Remind your partner to take care of their breast and help them to take care of the breast. But you should also get help and do advocate for breast cancer awareness. Asante sana, lakini jambo la mwisho kabisa tunataka kufanya, we are going to present the shield for Jhpiego's special English. Asante sana. Naomba tusiondoke tuone makabiliano alafu wata picha.
Thank you very much for a wonderful presentation and well-moderated clinical skill. We have two appreciation. One is appreciation of your continuous commitment and leadership in strengthening healthcare system across Tanzania and beyond. And another is the appreciation of your significant role in the success of 12th Tanzania Summit. The forum you delivered creates a vital space for exchange of pioneering healthcare insights. Thank you.
Asante sana.
Hola, que sigue.